Well, a very good morning once again, and many thanks for staying with us right here on NTV Uganda. My name is Romeo Busiko, and I come to you yet again with another pertinent conversation that is largely going to be focusing on this skyrocketing teenage pregnancies within this country. What we need to be tell the vice from actually taking center stage, the significance of contraception during this COVID-19 pandemic. Over 300,000 young girls got pregnant in 2020. That's how callous the situation is. In 2021, in the first 6 months, we registered 194,000 young adolescents actually getting pregnant in that regard. According to global research that is being expedited, we do know that 13 million young children have gotten into child marriages in that regard. What needs to be done to curtail the vice? Well, that's why I'm having these three panelists in my midst to actually divulge some of these recommendations that we could actually go a long way to reduce the teenage pregnancies in this country. Uganda has a population of 41.5 million people, but by 2030, if we continue with this trend where young mothers are giving birth when they are not ready, we shall be 69 million people by 2030. So that's how bad the situation is, and it also compounds the significance of contraception use among our citizens right here in this country. So teenage pregnancies are seeing a high prevalence within the rural areas. That is around some 24%, yes, within the rural areas. But in the urban areas, there's a reduction at only 19%. But then the mind-boggling issue is that there's a higher prevalence of teenage pregnancies within the rural areas, yet there's a low uptake of contraception within the rural areas, you know, vis-a-vis the urban counterparts. So we want to know why, what is causing this trend, and why are we in this situation. I do have Anne Kukundakwe. She is the program officer at the Center for Health, Human Rights and Development, CEHURD if you will. We also do have Mr. Robert Mutumba. Mr. Robert is the Principal Medical Officer, Reproductive Infant Health Division, that is at the Ministry of Health. He's not alone. We also do have Betty Chadondo. She is the Director of Family Health Department at the National Population Council. Well, let me kick off with you, Mr. Robert. Let's kick off by you giving us a situational analysis of how we are doing as far as uptake of contraception is concerned and the skyrocketing teenage pregnancies within this country. Go ahead.
Yeah, so thank you so much, and it's a pleasure to be part of this conversation. Generally, when you look at the country's performance on uptake of contraception over a 3 to 5 year trend period, I think there has been great progress in terms of a reduction in the country's total fertility rates.
I see.
With the last, according to the Uganda Demographic Health Survey in 2016, that put us at about 5.4%. That means that in a lifetime, averagely, a Ugandan woman produces about, you could say, 5 to 6 children. And of course, when you look at the performance over a 5-year period, where we go in 1990, where we are as high as close to 10, you see that that speaks to an improvement. But also we are still seeing a stagnation in the number of women like using contraceptives.
Especially in the rural areas.
Over time, especially in the rural areas. But of course, that's due to a number of reasons. Maybe that will come out as we have this kind of conversation.
What are those push factors leading to a low uptake of contraceptives within the rural settings?
Yeah, generally most of the research or the findings through interaction with health workers and communities during dialogues with members of the community speak to issues around myths and misconceptions in majority of the communities, and again these vary from region to region. We see that different communities present a number of myths and misconceptions around the uptake of family planning. And so, for example, in one of the fishing communities where I had a dialogue, the fishermen told us in that dialogue that if you use actually contraception, that your catch, when you go out fishing, you actually catch less fish if you use it in the form of a contraception.
This is happening.
And so yes, and practically I was in one of those community dialogues with the fishermen, And so you find that...
And we do know these are areas where we've seen an uptick in teenage pregnancies, the landing sites.
Yes,
people
definitely.
living near waterborne
and if you walk to some of those communities with the wide range of contraceptives, the following day, be sure to, you know, find those either thrown out in the bushes or whatever range, because those myths. And again, that's just one of the many examples.
Indeed. And
they vary from region to region. So that continues to bite. But also there are other factors, like some of the clients, if they walk to a facility and they are not able to access a method of their choice, and but also there are issues around the capacity gaps among health workers who may not be able to provide some of the methods. But again, that speaks to a lot of improvement efforts that the ministry, working together with partners, are trying to address.
And also we do know there is some kind of resistance coming in from the cultural and religious leaders who are adamant to let our young people actually access contraceptives because of their moral, religious values and so forth. What do you make of that?
Yeah, indeed, that's also a contributing factor, indeed. Cultural, religious and political, and people tend to bring out their own opinions.
Indeed.
And they speak to masses, you know, opinionating as opposed to really speaking out the facts. And you know, if you're a leader, cultural, political, religious, and you come out, you're speaking to a following, and then you're opinionating them, you're actually not speaking facts, but rather opinions and myths. Many of these members of the communities, because of the trust they have in you, they are more likely to follow you up. And we've had these scenarios where, you know, some of these leaders come out to communities and, you know, mention that family planning, for example, causes cancer. And, you know, they haven't done, you know, some of these studies
and so
that
forth.
really speak to some of those. So when we have leaders coming out, speaking out, sharing their own opinions, that alone has also gone a long way in frustrating efforts towards, you know, people coming, having families that, that they can actually manage. And eventually what that does, you know that in our country's Vision 2040, where we aspire, we want to see Uganda, you know, being transformed into a middle-income country. That can't happen if the country's population grows at a rate that overwhelms the existing resources, and it will remain a nightmare if we cannot able to control the population outburst for the country.
Yeah. Well, Betty Ichadondo, let's also engage her. She is the Director of Family Health Department that is at the National Population Council. We do know that some young mothers, 13 million worldwide, were forced into marriages at a very young age. We also do know that over 300,000 young women actually got pregnant as a result of forced relationships within this COVID-19 pandemic. Pre-pandemic, we still had a high prevalence of teenage pregnancies at 25. Now, in the pandemic itself, it increased to over 49%, meaning out of the 136 districts within this country and tops, he did have some 67 districts affected by these increasing teenage pregnancies. Kabale is one of those jurisdictions grappling with 12,000 teenage pregnancies. Northern Uganda, more than 200,000. So help us fast track our family planning commitments in 2020 vis-a-vis the prevalence of the COVID-19 pandemic. What worked and what needs to be improved?
Thank you very much, Ronnie, and
Indeed.
good afternoon, viewers. It is true we are seeing an increasing number of girls getting pregnant when they are still young, and this has been a problem. Actually, at one time we were saying this is a real disaster for this country, and COVID is actually revealing this very, very strongly. So in terms of family planning commitments that we made, that our president actually delivered at the Family Planning Summit in London in 2012, and which was renewed by the Honourable Minister of Health in 2017, this country committed to increase family planning uptake, and the contraceptive prevalence would increase to about 50%.
Yeah.
Right now, we stand at about 35%. We also committed to increase the unmet need for family planning, which is the number of women or girls that want to either not get pregnant or they are delaying a pregnancy but do not have the means to do so. We wanted to reduce this from about 35% then to 10% by 2020, but we have failed to achieve this for a number of reasons. The number one reason is the commitments we wrote were all rallied around increasing the financial resource, the domestic financial resource for family planning in Uganda to about $5 million a year. So that was 2012.
Yes.
So 2013 and 14, we saw this happening.
Right.
But over the years, the financial resource from government to family planning has not measured up to the commitment.
I see.
So this commitment was mainly meant to increase the family planning commodities or the contraceptives. And then we also had commitments that we made to mobilize communities to demand access and uptake family planning. And this also has not been able to bear fruit because of some of the reasons that Dr. Mtumba has highlighted.
Indeed.
One of these being the myths and misconceptions for family planning, but also the influencing factors either from religious, cultural leaders. And then we have this very big challenge of young people, of the youth, of adolescents accessing the contraceptives. They still believe they can use contraceptives in their own means. For one, you only swallow the pill when you're going to have a sexual encounter. Two, they do not have readily available money to buy the contraceptives, and yet accessing the contraceptives from the health facilities is a challenge because of the different, the way they are received or the way the health workers make the judgment about why the young people are using contraceptives. So many of these issues and factors have failed us from getting to attain the commitment that we made for the family planning 2020. And
But still we are seeing a prevalence of repeat adolescent pregnancies. This is a situation whereby a young mother, by mistake, gets pregnant, but then there's a repeat pregnancy taking center stage. And we're not talking about maybe last year, 2019, 2018, we're talking about 3 decades. In 30 years, the rate is at 50%. The repeat adolescent pregnancies that are taking center stage within this country, meaning we are still failing these young mothers. Up to now, 30 years on. Why is this still happening, Betty?
The main factor, when you take such a decision of getting pregnant as a young girl, then you do not have an open mind of even thinking about your reproductive life.
Yes.
So these young girls are lured into sex for many reasons. The main reason is material need. We've known that many of them get pregnant because they want sanitary pads, just a single sanitary pad. I remember there was a time that Stella Nyanzi was really walking this talk of ensuring that every girl in Uganda who needs a sanitary pad should access it. And I supported her in my own way because yes, you're getting pregnant because you don't have access to a sanitary towel. And this is a condition that is, you really need to have a sanitary towel. If you don't, it is a problem. Some of them just think that they have this peer pressure to engage into sex, which is wrong. But they are not getting into protected sex. So they end up getting pregnant. And once you get pregnant, it is like you're off the track of leading that path for development.
Meaning the COVID-19 pandemic might have made things worse, but even before that, pre-pandemic, we were actually regressing when it comes to the fight against these rising teenage pregnancies. 50% repeated adolescent pregnancies taken center stage since President Museveni came into power. That is how callous the situation is. Let's bring in our implementing partner, that is CEHURD. We do have the program officer, Ann Kukunda. She is the program officer at the Center for Health, Human Rights and also Development. A very good afternoon once again to you, Ann Kukunda, as a civil society representative. Why do you think our young people should have access to contraception? You and I, according to the figures I've been looking at, I know why. When I'm looking at the figures, we are 41 million. By 2030, we shall be 69 million. But for the viewer out there, give them reasons as to why we should actually be clamoring for contraception for our young people.
First of all, we need to start the conversation from why are the young people getting pregnant?
And who is making them pregnant?
And who is making them pregnant? And forgive me, Dr. Mtumba, and you, this is not to accuse the men, but behind every pregnancy, there is surely a man involved.
Of course, yes.
So, first of all, starting...
We are feminists here, so I'm sure he won't take offense, Mr. Mtumba.
So, first of all,
yes.
and we've seen scenarios where actually adolescent girls are getting pregnant by their fathers. I think there was a newspaper article that indicated that over 2,000 adolescents had been defiled, and these had been defiled by their fathers. So majority of those, 2,000, could have resulted into a pregnancy. So it was this is where it is starting from, the fact that even the young girls are not even safe from the people who should be their custodians. And these people include their people, their fathers, their male relatives that they stay with. It is the #1 reason why we have to make contraception accessible for a young person, especially in that scenario.
Because I was having Professor, that is Canon Gideon Byamgisha, he is a religious leader, and he was adamant to talk about giving contraception to young people. But then I asked him, what about situations whereby the breadwinner is the perpetrator, the father is the one forcing himself on this young mother? She cannot actually go to report because he is the breadwinner, she still needs him. So in case of such situations, shouldn't we be fronting the issue or significance of contraception to this young lady? Forced relationships.
We should, but also evidence has indicated that availing contraception to any woman, and this is irrespective of whether this woman is young or anyway, to delay their chances of getting pregnant. And we have a vision, one of our aspirations as a country is education for all. So in cases where this education for all is being harbored or hindered by a girl getting pregnant, evidence shows that actually if we give them if they have access to delay, they have an opportunity to delay pregnancy, they will actually stay longer in school, and therefore that is going to protect us from having a highly dependent population that is not educated, because when a girl gets pregnant, she drops out of school, she's unemployed, but she's expected to take care of herself and the child. And in most cases, maybe the man is not available to do that, or maybe the man is another minor who does not even have economic power or resources to take care of such a child. But also, availing of contraception or family planning helps in improving maternal health and infant health as well, because it means that a person is going to have pregnancy or carry pregnancy when they are ready to carry pregnancy.
The body is not ready. Chances of dying during giving birth are very high.
But also
39 out of every 1,000 live births are dying.
Yeah, but also COVID-19 has given us an opportunity to do a 360 check of our healthcare system. The government already is struggling to invest, to find resources to even deal with the impact of COVID-19. But already now the many escalating cases of teenage pregnancy come with a financial burden for government to deal with pregnancy-related complications, especially those that do not go well.
It is unequivocally clear we do not need these young mothers getting pregnant. 99 are dying out of every 100,000 live births. They are not ready at all. But then when you look at the statistics, I mean, you are amazed. You are actually astonished. 12% of our teenagers between the ages of actually 10 to 19 years are actually already married off. 10 to 19 and Kukundoki are already married off, 12%. By the age of 16, those in rural areas are already experimenting with sex. By the age of 17, in urban areas, young people are already experimenting with sex. What needs to be done to close this gap? that is hampering access to contraception, because we do not really need these young people getting pregnant. They can't afford it.
First of all, it starts with information. Information about sex, and I know this is very controversial, but information about sex and the consequences of sex. Letting this young person know that actually if they engage or they have a sexual unprotected sex with with a man or with a boy, that whoever they're engaging with, they will actually get pregnant. And when they get pregnant, it comes to drop out of school, them not being able to support themselves. So that information needs to be readily available. There is need also to make sure that wherever these young people are accessing sexual reproductive health and rights services at our healthcare centers, these services are available, but also they are friendly. Let a young person come and be able to say, because young people are not homogeneous. They are those young people that are exploited into sex work, you know.
By their own parents sometimes.
Either relatives or people who are supposed to be taking care of them.
You have some breasts, please go and make some money on the streets. I've seen this happen in the Nansana municipality area. Young girls will just be walking amok on the streets, not going anywhere. She'll wait, a border rider will come. Are you going anywhere, madam? She'll sit on the border. Now the guy will realize this lady is going nowhere. Then he will ask, madam, where are you going? That's where she asks, don't you have a home? So prostitution is taking center stage, being abated by border riders who are spreading now HIV and these teenage pregnancies among various jurisdictions. Poverty is to blame and so forth. But then what needs to be done to increase or widen access to these contraceptives?
Taking opportunities, the technological opportunities that have come as a country, and a case in point being self-care. And of course appreciating the government through Dr. Mutumba, Ministry of Health representative, for embracing the concept of self-care and contextualizing it in our own context is very key. Because with COVID-19 we realized that actually many women or many people who wanted to access other healthcare related services could not be able to.
Antenatal care.
And that was because of either ban on transportation, they are not allowed to move. Also, they fear to go to healthcare centers to access either contraception or family planning services because for fear to contract COVID-19. So an opportunity to utilize interventions like Sayana Press, where actually a woman or an adolescent is in position to protect themselves, to inject themselves or to give themselves a contraception, making sure that they have access to emergency contraception for cases of rape and defilement is very critical as a country. But also revisiting our commitments that our dear doctor has elaborated very well that we make, and these commitments come back, some of them in the ICPD plus 25. So looking, measuring how we are performing on some of these commitments as a country, and then making sure that at the national level we are putting in place or establishing efforts that are helping us to realize these commitments. And again, to the parents, you know, everybody has a role. We cannot say that it's only government that is going to eliminate. I don't think government has the magic. They can only do their part. But as a parent, if you're housing an adolescent, give them the correct information.
Many of these parents are waiting for schools to reopen so that their young people can actually get acquainted with some information on sexuality education. Tell them it's now or never that they should actually be divulging this information to the young learners.
For the fathers, please do not be the reason why your daughter's future is cut short because you're defiling them and making them pregnant. So making sure that parents play their role, making sure that each one of us plays their role, the media for amplifying some of the key issues that have happened.
We won't sleep over this issue. We shall continue. Go ahead.
Yeah, so.
Anne Kukundakwe, ladies and gentlemen, she is the program officer at the Center for Health, Human Rights and Development. They are doing a lot when it comes to advocacy and also this conversation that we are talking about. Let's also bring in the principal medical officer in the Reproductive Infant Health Division at the Health Ministry. That is none other than Dr. Robert Mutumba. Dr. Robert Mutumba, what kind of strategies have you expedited as the Ministry of Health to address the skyrocketing teenage pregnancies within our country?
Yeah, first of all, the ministry exists to give guidance. And so I'm glad that through a pillar called the continuity of essential healthcare services, so the ministry developed guidelines, but basically to health workers, but also to other implementing entities, on the continuing to provide SRH services during this particular period. You remember in the first lockdown, we were greatly affected and access to many of the SRHR services was quite hampered. So through these guidelines, health workers have been trained. We upload the support from different implementing partners who've supported the ministry in rolling out this guidance. And the two, you realize that the evidence, I think, is clear that when the girl is out of school, she's more likely to become pregnant. So through the Adolescent Health Division, working closely with the Ministry of Education and other government ministries, agencies and departments, the team, I think, has done a lot of work in developing SOPs to guide the reopening of schools. I know this has been delayed, and everyone keeps asking when schools will finally, be reopened. But I think we all know the reason. But I'm glad that that guidance has been developed. And right now, as I speak, the Assistant Commissioner in charge of Adolescent and School Health is working with a number of teams, visiting schools and, preparing them to, at a later point when it's safe, to have them open. And so when I think when the girls get back into the school, it's a very big protective factor to avert many of the escalating cases of the pregnancies, but also the other strategies around capacity building.
Indeed.
Especially focusing on building healthcare provider capacity. We know that the focus is method mix provision. Sometimes there are scenarios where a client shows up in need of family planning, but the health worker has a capacity gap, let's say in the insertion of an IUD, an implant, which actually might provide more contraceptive benefit. So if this health worker has that gap, they are more likely now to recommend a pill, which may actually not provide a contraceptive benefit to a client who would want to delay conception, maybe up to 3 or 4 or more years.
What about the attitudinal challenges among the health workers? They encounter a young person who has come to receive some kind of contraception or help, and then they say, oh, you're 16, you also need contraception, you're also engaging in sexual activities. Or if you are disabled, they'll say, oh, you also engage in such activities. And then they'll say, if you are a teenager, please go back and fetch your father or mother. I mean, how can a young person who is trying to hide a pregnancy from the parent or relatives actually go back and tell them, I want to access a health center to get contraception? Yeah, that's also,
it also gets, that attitudinal challenge is getting addressed during the training. There are lots of capacity building activities in trying to make the health workers become more adolescent responsive. Some people call it being friendly to these young people. And so, but for some of the health workers who would behave that way, I think they were just getting it wrongly in the context of the law, that you shouldn't provide certain services like contraception services.
Sometimes it could be actually a grown woman, but you have a disability.
Oh, yes.
And they feel like people with disabilities shouldn't be engaging in such shenanigans or sexual activity. So they're like, oh, you too. So they mock these individuals.
Yeah, so in that regard, the training that is ongoing and other capacity building efforts are really to orient the health workers on some of those other vulnerable groups that really need to have a right. For example, even during a pandemic period, every individual has a right to produce. And so whether less able...
Go ahead.
Yes, so what the capacity building efforts are focusing on is really to make these health workers become responsive to the unique needs of the different categories of people that show up. But also the ministry is strongly focused on demand creation and lots of media sensitization. We continue to call upon the different leaders, cultural, political, religious, in the different entities to really take this up and appreciate the fact that people need to come up to have families that should be within which they can manage. And family planning, I think sometimes people get it wrong. It's not meant to ask people to stop producing, but the message is simple: only produce the numbers of children that you can ably take care of. Whether you want 4 or 5 or 6, there's practically no limit to the number of children. But the message is really like, have a family that you can be able to take care of, so that the resources available do not rhyme with the numbers of the children that you are actually trying to talk to bring up.
But of course, the category of mothers we are talking about are not those who would actually sit down with their husband and, you know, plan for a baby. These are young teenagers who either were forced to have this relationship, defilement or rape taking center stage, and they couldn't have any other option but to actually father or have these babies in that regard.
Yeah, for such scenarios, those are usually unfortunate scenarios. But once that, for example, happens in the event of maybe a rape case or there are options of emergency contraception, but of course at the time when that gets too late, the best now is really
I was alluding that to your recommendation when you say they should plan for their children. But the category of people we are talking about here, they didn't even have the luxury to even sit down and have a conversation with the perpetrator. They just forced themselves on them. So that's why we ended up with 354,000 pregnancies in 2020 and 196,000 as we speak right now in the first 6 months of this year.
Yeah, so that's why I was mentioning that in such a scenarios where such has happened, I think now the role changes. Like, it's more of now a safe motherhood. How do we ensure that these girls who eventually conceived have access to safe motherhood services? Because at that point, this girl is already conceived, and the best you can now do is really to ensure that she can have a safe childbirth.
Betty Chadondo, shouldn't we be talking about creating a safe environment for our young teenagers so that they do not befall this fate? Creating a safe environment for them where they can thrive, because we are saying they did not actually plan for any of this. It was forced onto them. That's why they've ended up in this problem, knee deep in mire.
You know, the safest environment for the young people or for these teenagers is the home. And one of the reasons, which you all know, why they engage into sex, and the reason why we have higher rates of teenage pregnancy in rural areas than in urban areas is because of poverty. So what does it take to create a safe environment in an environment that is really full of hunger, disease? All these things are pushing these young girls to go and engage into sex. And you're very right with the closure of schools, because in certain parts of the country, in certain regions of the country, food has been provided at school.
Yes.
And this encourages these children, both boys and girls, to access the education centers, because they know they're going to receive a meal. So the safe environment we are talking about, and now I'm speaking from the perspective of the National Population Council, is having a comprehensive approach to addressing teenage pregnancy. So number one, we cannot run away from family planning, because already we have big families and we are failing to provide for them. So because of that poverty entrenched in our homes, girls slowly are either sent off by their mothers to go and get, we've heard stories of young girls getting chapati, 1 chapati and quarter kilo of sugar, and bring it back home. But and what are they paying for that quarter kilo of sugar? 9 months of suffering. Sex. And a lifetime of poverty. So for as long as we don't address issues of poverty, and family planning is key. Anna has already told us, family planning is that cost-effective investment that we need to embrace in this country. And for us, one of the key strategies that we have adopted as the National Population Council, which is clearly, highlighted in the second National Development Plan as a path towards achieving the Vision 2040 that Dr. Mtumba has been explaining, where we want to transform this country. We are aspiring, is ensuring that this country gets on the path to harnessing the demographic dividend, so that we have money that we are saving, money that we are investing, money that, once you have savings and investments, then you're not going to be poor. So that is one, and family planning is key to get us there. To reduce this high fertility, we must ensure that we embrace family planning. It is so sad, it is really absurd that these young girls get pregnant when they are still very young and fail to use family planning. So they continuously and frequently have more pregnancies, and these are unintended. Then 2, we have to make sure this girl remains in school. That is a strategy. We know worldwide, for as long as a girl is 18 and gets pregnant, then their mind is already tuned to think about having protected sex. The mind that is rather the 14-year-old, 15-year-old, 16-year-old, these things just happen. For them it is a natural occurrence, but it is a problem. And they never see it like that. And throughout their next life cycle, they'll never see it as a problem. So they continue pushing through births and frequent births. But a mind that is already tuned at about 19, 20 is going to be completely different from a mind that gets pregnant when they are 15 or 16. So we need to keep the girls in school. We need to also take care of our boys and the men who impregnate these girls. But also number 3, how do we address issues of poverty? We need to have livelihoods in the homesteads. These homesteads must have a living that brings them some income. Without that happening, it is going to be difficult. And as I conclude, I want to applaud this government, and I hope for the first time we are going to see the parish development model helping communities get out of poverty, helping communities to address the problems that exist in these communities. This parish development model, if it can be implemented in the way it has been designed, in the way that we are looking at what it is going to deliver, increasing service delivery, ensuring that families have an income, but also that families and communities plan based on the needs within the communities. We may go a long way in addressing teenage pregnancy, but also increasing family planning utilization.
But of course, you're talking about COVID-19, and COVID-19 has a correlation with poverty, meaning as long as we are still in this pandemic, people will still grapple with poverty, and poverty will lead to these risky situations whereby we shall see a continued resurgence of young teenage mothers getting pregnant in that regard. The 100K did not do anything in that regard to dampen the resolve of the perpetrators to actually go ahead and impregnate our young girls. So we are still knee-deep in quagmire, Betty Chadondo. Because you also did mention that information has been a problem. Don't you think we need to come up with awareness, sensitization campaigns? We go, expedite outreach programs to reach out to these young people, give them the information that they really need. Because you did mention for a 16-year-old engaging in sex, they do not know what the outcome is going to be. So meaning majorly, we just have to embark on a sensitization campaign when we go to these communities and actually talk to the young people on the risks of having sex and how they can avoid becoming pregnant.
And you're absolutely right, Ronnie. And one of the pillars of the parish development model is changing the mindset of the people and the communities. And this is going to happen through the 13th program of the National Development Plan, which is mobilizing communities and ensuring that there is a mindset change. We all know that knowledge is power. Without knowledge, we make so many mistakes.
Indeed.
So if we are going to address some of these challenges, some of these problems in our communities, we have to engage the communities through dialogue, through sensitization, working with the different gatekeepers in the communities. And this is the opportunity that we have. We lose this opportunity, Uganda is going to have lost so much. And keeping up the pace is going to be difficult. As the national population that the most important thing about the parish development model, we are not going to say that it needs more money. That, like we have already said, if it is a meal garden, it has to come with money. If it is Operation Wealth Creation, then there has to be money. This is an integral part of what districts have been receiving and what they have been, pushing out. So it is not a new development, but it is reorganizing the system of work at the parish level to ensure that, yes, communities are mobilized, information is given to them, information is shared using different avenues of communication, and I'm glad. I may be a little bit sarcastic, but I think COVID has given us one big lesson.
Go ahead.
This issue of innovation and technology, you know, we're always doing things traditionally, but if we can embrace information and technology, innovations, we are going to go a long way. It is going to be a very hard, you know, like a rock to walk, but I think the ICT ministry, national guidance, needs to put a little bit of resources to ensure that there is wide network coverage where it is not now.
As the director of the Family Health Department at the National Population Council, when you hear a statistic like we are 41.5 million, we shall be 69.7 million by 2030, what comes to your mind?
I already said it is like a disaster.
In 9 years.
Yes. And that is where we are heading unless we stop doing business as usual.
Contraception is the magic bullet?
It is going to be disaster itself. And that is where we are heading. And if you look at the different regions, there are lots of disparities.
Indeed.
If you just look at, we have what we call an atlas on family planning. I'm sure these two people here know about it. We have that atlas that shows total fertility rate disparities across the region. When you look at the northeast, that is where fertility is highest. Then you look at the eastern parts of this country, fertility is as high as Karamoja. But then when you start coming a little down, then fertility starts declining. You see 4.3, you see 3.4 in Kabale, you see, you know, Chigezi area. But why? What have these people done that these other places cannot do? And for me, that is why I think this parish model, looking at the challenges and changing mindset, not only mindset of the young people, of parents, but also the mindset of leaders in these communities. Because we also have a challenge convincing leaders about the benefits, the advantages of family planning. It has been a hurdle for me who has been working with a national population council for a long time. But we have seen slowly, even religious leaders now start saying, yes, we need family planning to have quality people that seek our services, that listen to the word of God. So we are slowly seeing this change. But we still have those that still believe that family planning is no good for anyone in this country.
There are so many, and we still have them because Uganda is a highly religious and conservative nation or state, if you will. Well, we do know that also Anke Kundakwe is here with us. She is the Program Officer, Center for Health, Human Rights and Development. We want to talk about what our stakeholders are doing on the ground to ensure that we curtail the rising teenage pregnancies within the country. Anke Kundakwe, what is being done on the ground, courtesy of CEHURD?
Thank you so much. I think CEHURD and other like-minded organizations, in collaboration with government, of course, and other development partners, what they're doing is that they're giving the information. They are creating awareness. They're having religious leaders, community leaders into conversations of saying this is how much the country or the community has to lose if we don't embrace some of the opportunities like availing family planning methods to either women. But also we are creating, we are breaking the myth and misconceptions. I am sure now the people who still, there are very few young people now who still think that if you have sex in a swimming pool you won't get pregnant.
No
and that
way.
is courtesy of organizations that continue to provide, you know, that continue to create mentorship program, recruitment of peer educators that continue to bust the myth and misconceptions. But also, again, as civil society organizations, we're a partner of government, and in most cases we've come up to provide research evidence to inform policy development and planning. We've contributed some of the studies to indicate how certain districts or certain pieces of certain parts of the country are faring, so that we are able to to able to make appropriate plans. Of course, not forgetting a watchdog role, holding government accountable. We've come, and I'm very glad that I had Dr. Mutumba talk about reopening of schools. And Dr. Mutumba, the request, I think, from civil society organizations that are watching us here are very interested in ensuring that the opening of schools that we plan for is not only to benefit COVID, but it is ready to receive young people from communities with all their challenges. Because the last time you saw what happened, we only focused on COVID, but we had people come with mental health related challenges. Also, we need to plan, if we opened school now, the numbers of pregnancy that are in those statistics, either those girls are nursing, are breastfeeding, or they're actually pregnant.
As we reopen schools, we should also be cognizant of the fact that some teachers were also abusing the school-going children in the school setting. So as these learners go back, we should also be cognizant of that fact and
have a clear plan for that young people who are unable to return to school because either they are pregnant or breastfeeding. Yeah.
All right, that is Anne Kukundakwe, Center for Health, Human Rights and also Development. We are talking about some of the challenges that have dogged this country as far as teenage pregnancies are concerned, compounded by a low access to contraception. Well, COVID-19 did make matters worse because many people couldn't move from one place to another and so forth. Cultural, religious and misconceptions that have taken center stage within our country have also made this initiative very, very hard. Contraception in that regard. But what kind of policies has the Ministry of Health expedited to ensure that we address the skyrocketing teenage pregnancies within this country? We do have Robert Mutumba, the Principal Medical Officer in the Reproductive Infant Health Department of or Division of the Health Ministry. Go ahead. Policies that have been established by MOH.
Yeah, currently we are fast-tracking the finalization of the section reproductive health policy.
I see.
So that's in the advanced stages, and I think very soon we'll have that
What's
concluded.
entailed in that policy, and why should we actually be glad that it's actually being worked on?
So that policy basically gives guidance to health workers, but also other actors in provision of section reproductive health services. So it gives that overarching guidance, and it answers a number of concerns that health workers raise, but also a number of other implementers.
So how exactly will that policy help us clamp down on these skyrocketing teenage pregnancies?
So the policy creates an enabling environment and comfort. So the health worker will actually be very guided on what to do.
I see.
And again, of course, we are finalizing also reviewing curriculums for provision of SRH services. And all that is aimed at giving guidance, answering questions that many of these healthcare providers have. The other is the adolescent health policy, which is also under advanced stages of development. In this policy, of course, broadly, this policy looks at, gives guidance on provision of adolescent health services in broad. But again, SRH service provision is also a component of that. We also have an adolescent health strategy that's also being finalized. And in this strategy has quite a number of interventions, strategic, both looking at the health provider side, but also the demand side. And in all this is aimed at really streamlining and harmonizing guidance to teams that really implement the SRHR services provision. But the ministry is also finalizing actually and reviewing a number of strategic documents, including what we have, a reproductive, maternal, newborn child and adolescent health sharpened plan. So when you look at that plan, this is actually the second plan, it also gives guidance and clarity on service provision, because there are gaps at the health, in the healthcare system side, but also at the community. So it's a two-pronged approach that looks at creating a favorable environment for service provision, but also generating demand.
Well, we also do have a school health policy, Robert, that has been largely been lying idle. It's not being implemented. Why?
Yeah, so there were some areas of controversy, but I know that the Ministry of Education is now taking lead, and hopefully very soon it will also be concluded.
Don't you think you need to actually help them in that regard, especially on the National Sexuality Education Framework? Learners would be much more willing to get this information from medical workers, people coming in from the Ministry of Health, other than simply a teacher coming in and just divulging this information. They would be much more in a better position to get it from a medical worker like yourself.
Yeah, maybe what I need to mention is that government entities work in collaboration, in partnership.
But mainly we shall see the Education Ministry on top of this implementation, and that's why, don't you think it's been slow in implementing this?
Yeah, so the teams have been working together, and there have definitely been delays.
I see.
But there's guidance coming in from both ministries in terms of how fast we can have this concluded. And I think that actually also brings out something which I wanted to mention as we wind up this conversation, that the issue of family planning, we probably was having a crazy thought that maybe we need to change the word, and people tend to appreciate that. I think there's been a lot of fatigue, but people really just need to appreciate the fact that they need to have manageable families. And it should be everyone's issue. It should not be a Ministry of Health issue. It's actually a population issue, like Dr. Betty has mentioned. And we will all be headed for catastrophe if we cannot work really together to avert the many unintended pregnancies that eventually result into maternal
Robert
deaths at the end
Mutumba,
of
what
the
you've
day.
largely given us futuristic recommendations on how we can clamp down on these skyrocketing teenage pregnancies. What I wanted, or what we wanted to bring out on this show, is what has the Ministry of Health been doing to help avert the teenage pregnancies that we are doing actively on the ground? What are you doing? Are you in the communities as divulging this information, sensitizing the masses about this issue? Or are we just coming up with futuristic plans, policies, and so forth, reopening of schools? Are we waiting for schools to reopen so that girls can be safe?
Yeah,
At the moment, what are we doing as these girls get pregnant within the communities?
The Ministry of Health works with partners, and so through a two-pronged approach, at the health facility level, we have been conducting method mix trainings, that is being able to enhance capacity of health workers to be able to provide the services.
All right.
But also at the demand creation side, we've been working with partners and then through the media to be able to sensitize the public about disseminating information on SRHR, and being able to also work on other health systems pieces, like ensuring availability of commodities, looking at the data systems, and being able to really build the capacity, but also create demand and sensitize communities through the different arms, the players.
All right, Betty Chadondo, talk to us about the significance of social workers. I mean, we cannot end this conversation without talking about social workers and how they can help us, advance this information to the people in the public, especially the young teenagers. Largely, they are still not essential. Up to now, we are not regarding them as essential people. One would say that's the reason why we are having these skyrocketing teenage pregnancies. A social worker would be able to tell this family there's something wrong, alert police, and then the situation is actually resolved. But then girls are getting pregnant, giving birth, and then getting pregnant again, swimming in the mistake.
So the social workers that we have at those levels are not called social workers, because at district levels we have community development officers, and then lower down we have parish chiefs, we have they have different titles, but they do exist. But one of the things, or one of the gaps in our thinking, we keep relating to teenage pregnancy, family planning as health business. But what the Ministry of Health has also done, they have community health workers. And these community health workers have some package of information, but they are also given additional capacity to be able to advance the health needs within the communities.
Right.
So what is missing is ensuring that these two groups of people can work together. The people we know as social workers should work very closely with the people we call the community health workers, the village health teams, to be able to create awareness on the issues that are failing this country to
Betty
get to
Chedondo,
development.
the Director of Family Health Department. Parting shots from you and Kukunda Kwe before I let you go. 40 seconds.
Okay. I think at some point of our lives we watch the president say that teenage pregnancies are not sicknesses, but figuring the conversations we've had and the impact this has, it's threatening economic existence. So therefore it is actually more than a sickness. And also calling upon stakeholders. We are very good at, there's this joke I don't like making, but that very good laws are made in Uganda, they're reviewed in Tanzania, and then Rwanda does the implementation. Can we change the narrative? The laws that we make and policies, we can actually do them here. Implement
Too
them.
many good laws, but then the problem is implementation. And Kukunda Kwe, representing Center for Health, Human Rights and Development. You do have Betty Chedondo, doctor, who is representing the Family Health Department and the National Population Council. And last but not least, you do have Robert Mutumba, doctor, who is representing the Reproductive Infant Health Division at the Health Ministry. He's the Principal Medical Officer. Thank you very much for having made the time to speak to us. All right.
Thank you, Ronnie.
It's now 3 minutes to 1 p.m. That means NTV at 1 shall be taking flight any time from now. Do look out for that encounter. I'll be right back. Good afternoon.